Challenges and Adaptation Planning for Health. The Global Climate Risk Index 2021 has ranked India as the seventh most affected country by devastating impact of climate change. The fifth assessment report of the International Panel on Climate Change conducted that climate-related extremes will lead to greater risk of disruption of food production, morbidity and mortality, damage to infrastructure, consequences of mental health and human well-being. The major climate-related health impacts in India include vector-borne and waterborne diseases, effects of heat wave, and impacts of floods and droughts, which would lead to food insecurity. At TERI, we have conducted several epidemiological studies in the domain of climate change and health, particularly focused on studying the effects of climate change on human health. These included mapping of vector-borne diseases, vulnerability assessment of health to climate change. Today's webinar is focused on initiatives in addressing climate change, national and regional, also for planning. This webinar is supported by UCHAI. Without further ado, I would request Dr. Vibha Dhawan, Director General TERI, to kindly deliver the welcome address. Thank you.
Thank you, Vidhu, and giving introduction to the issues we are going to discuss in today's webinar. Thank you very much for it. Well, when we talk of climate change, basically, I think sometimes we become very narrow-minded in our thinking, and it is basically that perhaps the temperatures are going to increase. But really speaking, if it is fluctuation in temperature, which then impacts precipitation, it's every aspect of human life, of life on this planet. Because the recent incidents, what we had witnessed about Chamoli, it is that a part of the glacier had melted, and that has impacted the micro hydrology, and the human life, animal life in that little part. And it came such suddenly that there was no time to prepare ourselves either. Again, the melting of glacier is not just limited to impact on water in a particular year. It also has long-term impacts on water availability in our rivers and so on. Vidhu has already mentioned about food insecurity. It's also coupled with what to grow where, because as the temperature rises, and we are already witnessing in India that you are not able to grow apple in the apple growing areas, you have to go further up. So all those changes are also occurring at a very fast pace. And I say there is more problem with the perennials than the annuals, because you still have time, to breed crops and put them in use year by year. But yes, it's a very serious problem. And that, unfortunately, I won't say just climate change, but otherwise also the way our consumption patterns are changing. And initially we concentrated more on meeting the calorific needs, and somewhere we have lost track of nutrition. And many of the crops which give us nutrition, they are low yielding, and therefore they become expensive to grow, expensive to buy. And also, I should say, somewhere a component of fashion, that people don't even consume coarse grains any longer, which is impacting the immunity system as a whole, and malnutrition related problems are there. Now, let's face it, climate change is something you can't stop. It is something that you can, at the moment, all what we are thinking of, that we slow it down. Of course, in years to come, we are also saying we will stop it, 2050, whatever year, we will be able to bring it to a standstill, or maybe even able to reverse in years to come. And scientists all around the globe, they are working on realizing this dream of development without climate change or without adding further to CO2 or greenhouse gas emissions and so on. The important thing is that while some of these things are obvious, there are many which goes unnoticed. They come in such a subtle way that we don't even notice that something is happening to our health. Of course, we started realizing at one time indoor air pollution, especially by burning firewood, improved stoves came. But then on the larger platform, we are thinking that temperatures are gradually going up. And so are the parasites, whether for human, animal, plants, insects. So all those are also changing their pattern and they are becoming more problematic. And then the next impact is that we start eating antibiotics, we start spraying pesticides on plant, which further worsen the environment and also our health. And I always say that, look, health is all like, since I'm a plant scientist by training, and whenever this air pollution due to parali burning takes place, then immediately it is that who has money to invest in machines, it will become expensive, but we forget what is the health burden as a whole, because what is happening is that each one of us is spending so much of money in buying medicines, and in spite of that, our lungs are still becoming weaker and weaker. So what needs to be done is that all these problems related to climate change on health, not just climate change, but also events such as burning of crop residue, etc., they are to be studied very carefully and in partnership mode. This pandemic has shown us that diseases don't get restricted to a region. Within no time, its epidemic becomes a pandemic. And it is one strain evolved any part of the globe, will take no time in traveling to the other. So public health and impact of climate change on public health requires working across areas, across international boundaries, and work in a partnership mode. So I do hope that in next couple of hours, that is what one will be discussing about climate challenges, adaptation planning for health. So wish you all the best. A very important topic, and we all have to find a solution together. Thank you very much.
Thank you, ma'am. Now I would like to invite Dr. John Balbus, Senior Advisor for Public Health, Director, NIH's WHO Collaborating Center for Environmental Health Sciences, to kindly deliver the special address for today's webinar.
Thank you so much, Dr. Gupta, for the introduction, and greetings to all, and especially to Director General Dr. Dhawan and Additional Secretary Ms. Arti Ahuja, who will be speaking after me, and greetings to all honorable session chairs and speakers. It's a distinct pleasure to be able to extend greetings on behalf of the National Institute of Environmental Health Sciences, part of the National Institutes of Health in the United States. We've been very pleased to support the collaboration known as Understanding Climate Health Associations in India, or UCHAI, for 5.5 years now. And UCHAI has, some of the work of UCHAI will be discussed today. Our UCHAI partnership is one of several collaborative arrangements NIEHS and NIH have with India relating to climate change, air pollution, and environmental health in general. From the NIEHS side, Dr. Sri Nadador has helped to develop a memorandum of understanding with the Council of Scientific and Industrial Research on environmental health and toxicology issues, as well as a joint funding opportunity with the Indian Council of Medical Research on air pollution. And NIEHS also supports the Public Health Foundation of India through a grant in our National Institutes of Health GeoHealth program, coordinated by the Fogarty International Center. So we have many different partnerships, and very pleased to be part of the webinar today as part of that. The sustenance of our UCHAI collaborations for these 5.5 years has been the result of guidance of wonderful experts from outstanding partner institutes who comprise UCHAI's Science Advisory Committee. The experts include Dr. Krishnan, who chairs, who we'll be hearing from later today, and also other colleagues from the All India Institute of Medical Sciences, from the National Health System Resource Center, the International Institute of Health Management and Research in Delhi, the Indian Institute of Technology in Delhi, the Indian Institute of Public Administration, National Institute of Malaria Research, the National Health System Resource Center, the National Institute of Urban Affairs, TARU Leading Edge, and of course, Meena Segal and the Energy and Resources Institute hosting our webinar today, which has been the Secretariat of UCHAI for the past several years. Our goal has been to share knowledge about the health implications of climate change and to partner together to raise awareness and help train health professionals across the country in assessing the health threats of climate change and designing adaptation plans to protect public health. At the time when UCHAI began its journey some 5 years ago, discussions on climate change and health were still at a very early stage. And today, as we'll see, members of the advisory group lead 4 of the 15 centers of excellence that were created to accomplish the vision of India's National Health Mission under the National Program on Climate Change and Human Health in the Ministry of Health and Family Welfare. This parallel development of climate change and health cooperation and programming is wonderfully demonstrated in today's agenda, which brings together experts from the Government of India, from academic institutions and non-governmental organizations in India and abroad, and the World Health Organization and regional representatives. As the world continues to grapple with the COVID-19 pandemic, there is also a very clear parallel realization that the health threats associated with climate change are not only real now, but will only continue to become more severe without actions taken. These actions are needed not only to mitigate climate change itself, as Dr. Dewan discussed, but also to build the resilience of health systems and communities to the impacts of climate change. Climate resilience needs to become as mainstreamed into the practice of health departments at all levels of government as the current pandemic responses are very much a part of every public health department. The steps range from modeling and predicting health risks from climate variability and change, and assessing the vulnerability of people and health systems, to being able to train the workforce to have competence in these areas, and on to assuring healthcare infrastructure, including not only the buildings and the staff of health systems, but also the water and energy systems, and making sure that they're hardened for increasingly severe extreme weather events. Both the United States and India have had to cope with the challenges of providing health services for the COVID epidemic in the setting of typhoons, floods, and heat waves this past year. I'm very much looking forward to the talks we'll hear about tools for enhancing the resilience of health systems. We also have to be concerned with the resilience of our populations, especially those who are most disadvantaged, who are living in poverty, who are facing the most discrimination. COVID has been a huge challenge for communities and individuals for, of course, our health and respiratory health, but also for our mental health and for our economic well-being. The recovery that we look forward to from COVID will need to help strengthen the resilience of communities and hopefully help us build back better in ways needed to face the growing challenge of climate change. I point to the World Health Organization manifesto for a healthy recovery from COVID-19, a very interesting document released last May, which offers prescriptions and actionables for a healthy and green recovery. And they have 6 prescriptions. One is to preserve and safeguard nature and our ecosystems. Second is to ensure access to clean water. Third, to ensure a quick and healthy energy transition. And this is, of course, central to both of our countries and all the world. Fourth, to promote healthy and sustainable food systems, and Dr. Dhawan has already noted the challenges to food systems and nutrition in India, which is a major area to be focused on. To build healthy and livable cities, and to stop funding pollution. In the United States, we have a new administration which has made climate change and equity two of its four priorities in addition to fighting the COVID pandemic and economic recovery. And the administration has issued executive orders on tackling the climate, many executive orders, but two specifically pertaining to climate change and health. One called Tackling the Climate Crisis at Home and Abroad, one called Protecting Public Health and the Environment and Restoring Science to Tackle the Climate Crisis. These executive orders have a very strong focus on equity and social disparities in the United States and call for such things as creating a new Office of Climate Health Equity in the Department of Health and Human Services and setting up a new working group to reduce the risks of climate change to the health of vulnerable populations. In addition, a number of other executive orders have elevated working groups on environmental justice dealing with many of these issues as well. So our adaptation planning processes will need to be inclusive, assuring that we co-develop interventions with the people who are most at risk from harm from climate change related stressors and harms to their health. Lastly, even the best climate health and adaptation plans are likely to encounter challenges in their implementation. Last week, I had the honor of organizing a satellite session at the annual meeting of the Consortium of Universities for Global Health that included my UCHAI colleagues, Meena Siegel, Nitish Dogra, and Dr. Anand Krishnan. The satellite session explored the potential for applying the principles of implementation science, which have been developed in part to speed the translation of biomedical research into clinical practice, but in this case onto climate health adaptation. We are now working to support this concept in order to better anticipate implementation challenges early in the process of adaptation planning and to come up with ways to improve the real-world effectiveness of our climate and health adaptation plans. So in closing, our 5 years of collaboration have seen many changes in both countries with respect to climate change and health adaptation. I am optimistic we are on the cusp of both significant advances and strong partnership in protecting and even improving the health of people in our two countries and around the world as we together face the challenges of climate change and health adaptation. Thank you very much. I'm very much looking forward to the program today, and I'll turn it now back to you, Dr. Gupta.
Thank you, Dr. Balbus. Now, may I please request all the speakers and panelists to switch on their video mode for a photograph. And also, since this webinar is going live on YouTube. So, kindly video modes, please. Thank you. Now I would like to welcome Ms. Aarti Ahuja, Additional Secretary, Ministry of Health and Family Welfare, Government of India, to kindly deliver the keynote address on the topic Climate Challenges and Building Resilience of the Health System. Thank you.
Thank you so much, and good afternoon, good evening, good morning to all colleagues. I can see senior colleagues here who know much more about this topic than I do. So it's really a great honor for me to be talking to everybody today. I think you're all aware, and it has also been alluded to by Dr. Dhawan, that with the climate change happening, health is getting impacted majorly. And we have evidence that bears that out. Recently, the burden of disease study was done by ICMR across the country. In fact, it was a global study where the climate-related factors such as air pollution have come out as the major factors leading to NCDs, for example. So the burden of disease that is shifting towards the non-communicable diseases is to a large extent impacted by climate change. So that is the evidence before us. And in fact, Dr. Dhawan was also mentioning about malnutrition, and that's something that I have been personally working on and been involved with for a long time. And it is a fact that when in the latest NFHS we see wasting having gone up, stunting having gone up, it has to do with the kind of food, not just the kind of food that's being eaten, the diversity of food, and also the frequency of food that's being eaten, apart from many other factors, of course. That's not the only thing. But definitely it impacts. And it becomes a kind of a self-fulfilling prophecy, which is very, very inequitable in its distribution. We all know of the socio-economic gradient in health, and it gets further exacerbated, further accentuated when we take into account the climate change and the impact it has, which is majorly on people who are otherwise not able to either manufacture their own air or not travel in AC vehicles or not or who are exposed to those kind of things much more than people who are well off are. So it really exacerbates those inequalities. And that is where the impact of climate change is at a very, very personal and at a very, very granular level, which is what we need to keep in mind. And because it is at a granular personal level, the response cannot be in silence. The response has to be a systemic response. The whole system across board, across ministries, across levels has to respond to that. So let me start by telling you that after the Southeast Asia regional Malé Declaration, to which India was a signatory, what all has happened in India. And of course, in 2019, the World Health Assembly also took note of the climate change and advocated a number of things to be done by countries. So I'm going to tell you very, very briefly on what the Ministry of Health has been doing in the context of climate change. So we have a, the Ministry of Environment and Forest is the nodal ministry, but as part of that, a health mission has been formed, and the Ministry of Health and Family Welfare is the nodal for that. So the mission is called the National Program on Climate Change and Human Health. It is being anchored by the National Center for Disease Control. And they are the ones who have been monitoring it and taking it up with the states. But having said that, the to walk the talk or to make sure that it is implemented in the right spirit, funds have already been provided to the states from the National Health Mission. And now we are also taking up independent budget line for the National Program on Climate Change and Human Health from the coming year, so that we are able to focus much more. So let me tell you first about what is the systems approach that has been followed. The first thing is that a national action plan on climate change and human health has been developed. It got developed in 2018, but this year we've revised it. And there are 14 climate sensitive illnesses or problems that have been identified, which have been included as part of this. And on the sidelines, let me also tell you that a integrated health information platform that had been developed with the support of WHO is now being rolled out from the 1st of April across the country, which will be able to tell us about the the spread or the coming up or the occurrence of communicable diseases as well as later on non-communicable diseases. So this is going to be quite a game changer for our country in how we look at the occurrence. So having made the national action plan, the next step is making the state action plans. And in this, our centers of excellence, many of whom are also represented in today's webinar, they have been very active and they have helped the states draft these state action plans. Currently, 28 states have already made their own action plans. Apart from that, to institutionalize and ground this whole activity at the state level and even down to the district level, State program officers have been notified. The environmental health cells have been set up in all the states. And under the state health secretary, a multi-level task force has been formed in all the states. And they have also they meet regularly and they take up action as per the vulnerability assessment and the action plan. And we have recommended, and 17 states so far have also formed the governing body under the state health minister, which becomes a high-level body to take up whatever interdepartmental, interagency issues are there at that level. So I'm going to tell you about 5 major buckets of the NPCCHH program, which I mentioned, which I talked about, and what all it has been doing so far. Last year was a disruptive year for everybody. And in terms of the whole issue of climate change and its impact on health, it is an irony that a virus was able to stop everybody, the whole world, on their tracks and gave us time to introspect and realize how important it is that we look at these things in a holistic manner, and that we also have capacity to respond, and we also have capacity to take preemptive action. So I'm going to talk a little bit about that. So the first thing is that if we are to reach down to the granular level, if we have to reach down to the last person, then we need to create awareness. So in that, public health advisories have been issued, and different days are being celebrated, and also IEC material has been developed through our centers of excellence. And there is a running social media campaign from the ministry as well as from NCDC, where at different points of time the evidence is brought about, and what needs to be done at this point of time is told to the people. The second aspect is bringing the knowledge from the national or international level down to the state and district level. So I mentioned about the nodal officers. All of them have been trained, and with their help, community level training modules have been developed. This is being done even at the level of the village, that the community level modules are being delivered. And I'm very happy to share with you that 6 medical and allied health councils, which are Medical Council of India, Dental Council of India, Nursing Council, the Council of Homeopathy, Indian Medicine, and the National Board of Examinations, have accepted our proposal for inclusion of health impacts of climate change and adaptation measures in their training programs. So you can imagine that with this kind of an input, this whole issue gets ingrained in the healthcare delivery professionals. That was second. The third is the health sector preparedness and response. And how do we do that? I mentioned about integrated health information platform. But till that comes into being, we have set up sentinel surveillance sites, and they will continue in any case. So these sites are doing surveillance in the context of air pollution as well as heat-related illnesses. So what they do is ARI surveillance. We have been doing in the 6 central hospitals in Delhi from 2017, which has now been extended to 49 cities and 60 hospitals. And we look at the data. Then 230 hospital nodal officers have been trained in that. For the heat-related, district heat wave alerts are sent based on the surveillance data, and vulnerability assessment is done. And we also keep having regular review meetings. Recently, Secretary Health chaired a meeting with all the stakeholders. I had a meeting after that with the states and with other partners. So that is something that we keep on emphasizing. The next point in that is that under the National Health Mission, the that the Indian public health standards were brought out, and in that the component of climate resilient and green healthcare facilities has been added as being part of the public health standards. So that is again bringing about a system change. Now, the fourth point under this plan is about partnerships, which is what we started with, that if you have to build a system, it has to be about partnerships, because when the individual is concerned, it's about the agriculture yield, it's about the kind of food, it's about the kind of air pollution, it's kind of exposure to other hazards which happen on account of climate change. So everybody has to come together in that. And that is why we have reached out, first of all, with other health programs, such as the non-communicable disease program, the Vector-Borne control disease program, the emergency medical relief, etc. That is within the ministry, but also outside the ministry with other ministries and departments with whom we need to coordinate. Sorry about this. And then also we are collaborating with other national institutions, TERI, for example, who is hosting the webinar, as well as with WHO, with World Bank, UNEP, etc., on these issues. And I must say that we have been receiving a lot of support from all our partners. And then, of course, last is research-based activities, because we all know that evidence is very important and policy is evidence-based. So a lot of strengthening of the research is being done. ICMR and other institutions are being supported for air pollution studies. In fact, recently, the Parliamentary Standing Committee asked us about that, and in the context of COVID, and we told at that time in September, October, the cases were going up in Delhi, and the pollution was also going up in Delhi. So there are studies to that effect on the, when there's air pollution, whether COVID cases go up or not. So it had a very direct relevance at that time. And it really supported the cause for ensuring that these things don't happen and they don't impact something negatively that we're already dealing with. So building that evidence is very important, and 30 institutions have collaborated. They are doing research, which is coordinated by ICMR, and they've also brought out a compendium on the research that's been done. However, it's an ongoing activity, and we will continue with that. The centers of excellence, a word about them. There are 16 centers of excellence, including AIDS at national level institutions, who have each been given one area. For example, vector-borne diseases, allergic diseases, waterborne, nutrition-related issues, occupational health, and they're all working on that. They are developing the state-level action plan formats, hand-holding the states. They are developing training modules. They are developing IC materials. They are doing surveillance. They are doing research, etc. They're doing documentation. So this is all coming together. And I think drawing parallel from COVID, since I'm also kind of involved with that, drawing lessons from COVID, which came very suddenly and in an unanticipated manner. But this is something that we know is there. This is something we know has a huge impact. So this is something we can actually tackle if we all put our minds to it. But the lesson from COVID is that it has to be an all of government and an all of society approach. It is not something, because something that is nobody's responsibility is something we know in government does not get done. So it has to become everybody's responsibility. Everybody has to become accountable, and everybody has to do their job well as far as government is concerned. But then we also have to partner with academia. We have to partner with other agencies. We have to partner with our partners in the development sector. We have to partner with private businesses and take it forward. And again, drawing the parallel from COVID, it has to be a proactive and a preemptive approach. Now the time has come for that. The time is no longer there that we can sit back and plan. We have to walk the talk, and we have to put our plan in action. So thank you very much for having invited me to this webinar. It's been an absolute pleasure. And I really hope that we are able to meet in person someday and it will enrich me at least and the ministry to get inputs from all of you in person someday. So thank you very much.
Thank you, ma'am. Thank you for this informative talk. Now we'll start with our first session on regional and national initiatives in addressing climate challenges. May I please request Mr. C.K. Mishra, former Secretary, Ministry of Health and Family Welfare, Government of India, to kindly chair the session.
Thank you very much. And we've heard some interesting inputs and insights from all the three speakers that we had today before this, Dr. Dhawan, Dr. John, Aarti Ahuja. One thing that gets established by whatever we heard from the three speakers is the fact that we have a challenge before us. And I guess if you want to tackle any problem and find solutions to the problem, the first step is really to acknowledge the problem. And what came through the three discussions was that there is an universal acknowledgement of the problem of climate change and health, the impact and the possible solutions. They're both being discussed. But I will try and put it in a perspective. The panelists who come after me will surely have a lot to say. I have been of the view that we've been talking about climate change and its impact on health for a long, long time. But still, globally, it has not been given the primacy that it needs to be given. If you look at the discussions at WHO, for example, I mean, this is mentioned as one of the critical issues, but never found center stage to be tackled on a war footing. Less even at the UNFCCC COPs that we have, where all kinds of climate change issues are discussed, and you have a small window discussing the health impact. So the point I'm trying to make is that globally, we still come to terms with the fact that this is a reality where we need to really, really tackle things in a big way. Ms. Aarti Ahuja was just speaking about the ICMR burden of disease study. And she spoke about the evidence that we have gathered. She spoke about the nutritional issues that have come about. All these studies are only sharpening our knowledge. But the fact remains that the impact has been visible for a long, long time, and people have been talking about it. We need to now, as an institution, as governments, as society, as community, go beyond the studies and evidence collection to find solutions to the problem that we have today. It's, the common belief whenever you talk about health impact of environment or climate change, the common discussion that goes around is about air quality and how it impacts. It's actually much beyond air quality. It's environment. It's the climate, which is getting impacted both ways. It is impacting our health and our behavior is impacting climate change. We need to pause for a moment and look at the reports that we have of the way we are treating our green patches, we are treating our forests, we are treating our animals. You look at the reports of zoonotic diseases, I think at some stage we have intruded very heavily into the space which was not ours, space that belonged to nature. So we've started occupying that space, and that is now creating an issue which is impacting everything, including our health. I don't think we still are in a position that we'll vacate that space, but we need to find solutions to protect our health from the adverse impact of all that. We always, in our discussions, whenever we talk about climate change, talk about sustainable production. I think it's time that we focused on sustainable consumption. And this came up earlier also. Sustainable consumption is the key to connecting such things and trying to find a solution to the impact on health issues. And I think in all these seminars and webinars that we have, we need to talk more and more about sustainable consumption. That is perhaps a way out of many of the problems that we have. Let me give you one more example. We keep talking about immunity. The recent pandemic has shown the varied immunity levels across the globe. Now, if you go deep into the causes of immunity, much of it lie in nature. Much of it lie in consumption. Let us take India, for example. The consumption patterns are different, and perhaps there is a case there of a better lifestyle, a consumption which is frugal, consumption which is need-based. So we need to look at all these aspects, and some of these may not have still great scientific evidence, but we need to look at all these aspects and try and spearhead a concerted effort which will take us ahead. Yet another point that I would like to mention, which the task force and the other organizations that are looking at the climate change now, must look at, and NCDC in particular should take into account this, that it is not just about mitigation of climate change. Mitigation is a story that is being told and retold time and again. The story that has not been told is the story of adaptation. And if we really want to tackle climate change, the critical element is adaptation. And it is here in adaptation that lies the solution to the health issues that we have. Look at agriculture, for example. One of the critical elements of adaptation that India is looking at. And globally, at every forum of the climate change, India has been pleading to the world that we need to focus equally on adaptation. Small farmers, agriculture, adaptation, these are critical issues for India. And what does it mean? I think adaptation to better agriculture practices straightway means better immunity and better nutrition. And as we write the story of adaptation, we need to take local issues into factor. And the country as a whole needs to recognize that these contribute heavily to health issues and health impact. If I remember correctly, it was in 2019, the climate change and the action plan for climate change had 8 missions. We added a 9th mission and a 10th mission. The 10th, of course, was on the coastal side. But the 9th mission, which was very critical and was added in 2019, was the mission on health. And the Ministry of Environment then requested the Health Ministry to spearhead that. And the Health Ministry is now doing a lot of work, as you heard, on that issue. The reason for creating a vertical and a mission on health was that to bring back the focus on the adverse impact of climate change on health. And let me also say that it's not the first time that we have spoken about it. I think it was way back in 2016 that PHFI did the first study on indoor air pollution and its adverse impact on health. We went through the entire process of doing a study. Empirical evidence was brought about, but unfortunately, we were not able to design a program to really address the issues. And I think it's time now in India to design programs for that. It's a very heartening thing to know that the National Health Mission is providing funding for these issues. So states need to come forward and actually design specific state-specific programs. If you look at the National Climate Change Action Plan and the State Climate Change Action Plan, the emphasis that the Ministry of Environment has laid is that it should be area-specific and need-specific. So if you are able to design a program which is need-specific for health in every area, perhaps we will be able to do a much better job. And an example I would give is a health plan on adverse impact of climate change in an area where there's so much of mining, etc., like Orissa, would be completely different from some other geography. So we need to work on this very closely. Aarti Ahuja just mentioned that we have created the structures. It's a good first step. We need to look at it very closely. There are not many countries in the world which have even created structures which will tackle the adverse impact of climate change on health. But fortunately, India has done it. And now we need to move ahead. We need to actually, as I said, implement the programs, particularly with a reference to adaptation, and tie it up with the climate change issues that we are facing at the global level. I was really surprised when this issue was raised at the last COP, which was 2018 in Poland. And the response really was more academic than anything else. So I think we're still struggling with the realization that we do acknowledge a problem, but we're not really trying to find solutions to it. And I'm deliberately being provocative and deliberately trying to provoke people into a thought process where we emerge with a program which can be called national and at the same time address specific issues. We heard that the government is making plans in association with certain bodies. Let me tell you that neither climate change nor health can be the business of government alone and should not be the business of government alone. It's a collaborative effort, and whether it is an effort on climate change or health issue, it has to be everyone coming together. So what is the need? The need is for the Ministry of Health actually to create a platform where all the actors can come together, and the ministry should then decide the theme on which these actors would move. If that platform is created, if that coordination is brought about, I think very soon we will see far more progress in this direction than we have seen today. But let me also thank the Ministry of Health for having taken this forward. And in the last 2 years, I'm sure we have moved ahead and created many new things which will help us in future. So we will straightway get into, I think, the panel discussion on this. We have two panelists, and I'm sure they would come in and give their views, the technical views and the expert advice. My point would be that institutions like TERI need to continuously drive this for the simple reason that they have the ability to bring about a convergence between various players, and it wouldn't be wrong to say various diverse players in this, bring them together and try and see what is cooking in the pot. So thank you very much for the patient listening, and I hope we have a very fruitful discussion today. Thank you. Am I audible?
Sir, you are audible, sir.
Okay. So if it's okay with you, can we now request Mr. Hussain Rashid, Regional Advisor, Water Sanitation and Climate Change, to deliver his talk on the environmentally sustainable and climate resilient healthcare system. Dr. Rashid, the floor is yours.
Thank you, C.K. Mishra, and good afternoon or good evening, everyone. And once again, thank you, GTC and TERI, for inviting W2O to be part of this webinar today. Before going into the presentation, I just would like to give me the opportunity and allow me to set the context for which I will focus the next 10 to 12 minutes. Climate change, as we all heard, is an undeniable threat to the health and well-being of people and livelihoods across the globe. And as such, WHO has prioritized climate change and environmental health programming. In 2015, WHO issued the operational framework for building climate resilient health systems, which describes how to maintain and integrate climate change across the health sector. As such, the operational framework provides a flexible structure for adaptation to the national context built on 10 key components of climate resilience. As you know, we have 11 member states in our region in Southeast Asia: Bangladesh, Bhutan, DPR, Korea, India, Indonesia, Nepal, Maldives, Myanmar, Sri Lanka, Thailand, and Timor-Leste. And they all have a combined population of just over a quarter of world's total population. They vary in size and population, and the climate challenges also varies from country to country. The most recent estimates of the environmental impact on health in the region come from the WHO report, Preventing Diseases Through Healthy Environments, a global assessment of the burden of disease. Globally, 12.6 million deaths, or 23% of all deaths, and 22% of all disability-adjusted life years are attributable to environmental risks each year. In summary, it is estimated that in WHO Southeast Asia region, 3.8 million deaths, representing 28% of all deaths and 24% of all deaths in the region, could be averted by tackling environmental risks. Now, let me share my presentation. So I will be, in this presentation, I will look into the new WHO guidance on climate resilient and environmentally sustainable healthcare facilities, the framework for building climate resilient health facilities, the tools and frameworks available, and some of the regional highlights and activities that WHO is working on. And now let's look at the new WHO guidelines. The main goal of the new guidelines is to increase the climate resilience of health facilities, to protect and improve the health of their communities in an unstable and changing climate, while also focusing on maximizing the available resources and minimizing the release of wastes by becoming environmentally sustainable. It guides professionals working in healthcare settings to understand and effectively prepare for the additional health risks posed by climate change, monitor, anticipate, manage, and adapt to the health risks associated with climate change, guide health facility officials to work with other stakeholders, including water, sanitation, energy, transport, food, urban planning, and environment sectors, provides tools to assist healthcare facilities to do their assessments, to understand the level of resilience to climate change threats, and their environmental sustainability. Also promotes and ensure health facilities that are constantly and increasingly strengthened and continue to be efficient and responsive to reduce inequalities and vulnerability within their local settings. This is the framework of which what I have explained earlier, which shows how this is being achieved. Now, if we look at on the left side, which shows the climate change factors, on the left side, the environmental impacts, and this is how this builds on focusing to establish the resilience through the improvements to health workforce, wash and waste management, energy and infrastructure, technologies and products through adaptation of systems and technologies, which allows for sustainable health facility operations and achieving the main goal of healthy people and healthy environments. If we look at the available tools and frameworks, as well as regional initiatives and activities, that are available to member states along with the new guidelines, and we are helping the countries to adapt to the regional context. Now, if we look at the regional activities that we are working on in order to address the climate change and to mitigate, member states adopted Mali Declaration, which was mentioned earlier, in 2017, and now we have the Regional Plan of Action for WHO Global Strategy on Health, Environment and Climate Change from 2020 to 2030, which was adopted in 2019 Regional Committee. These are the 4 strategic areas of work under the Regional Plan of Action. As you can see under Area 3, Strategic Action 3.2 addresses promoting healthcare facilities that are climate resilient, green, and healthy. In addition to the Regional Plan of Action, we also have a framework for action in building health systems, resilience to climate change in Southeast Asia, which will come to an end by next year, and hopefully we will come up with a new strategy, a new framework for action from next year on. WHO Regional Office provides support from member states in advocating and raising awareness on the health impacts of climate change at national, regional, and global levels, strengthening partnerships, which Mishra also mentioned about, in addressing the climate change impacts through adaptation and mitigation measures, enhancing scientific evidence by developing research capacity, and facilitating research in and between countries and strengthen existing health systems. Now, WHO CRO, we are also aiming to develop a campaign toolkit to support country activities on climate resilient WASH, climate resilient and environmentally sustainable healthcare facilities, and establishment of integrated disease surveillance system and online training courses. Healthcare facilities in the region need to assess climate change risks and adaptive management strategies to be resilient. For this, there is need for an in-depth assessment of the existing status of healthcare facilities in the regional context, followed by identification of adoption and interventions to integrate climate resilience into the operations of these facilities. So we are working on to adopt the global guidelines and do the assessment to be completed by this year. We have also developed a framework SOP document for the region to leverage the predictive power of climate change modeling and weather data to improve health surveillance and early response systems. So in short, we are helping to develop SOPs, guidelines, toolkits, knowledge products, and situation analysis reports are going on at final stages. And we are also supporting in coordination with member states to develop proposals to access climate finance through Green Climate Fund and supporting the integration of health into existing national adaptation plans and nationally determined contributions process. Apart from that, we are also supporting to do the vulnerability assessment. I think COVID-19 pandemic has given us further opportunities to build on, and we will be working on this area and support the region. COVID Green Recovery Plan by WHO was looked in by John Belvis in his remarks, and I will not go much into it. Finally, I also agree that we need to address the consumption pattern and related actions to address the bigger issue we have in front of us and achieve sustainability. So with this, I conclude my presentation. Thank you. Sure, you're on unmute.
Thank you, Dr. Rashid. Thank you very much for that presentation, for presenting not just CRO's perspective, but also the regional plan that we are coming up and WHO's guidelines as well as strategies. So these are some of the tools that we are going to use in future to build our plans and build a perspective on how we move on the impact on human health. So thank you very much for that. Thank you for the presentation. And next we have on the panel Dr. Akash Srivastav. from the NCDC. And Dr. Srivastav will give us his perspective on the national programs on climate change and human health. And as you just heard earlier, NCDC has been tasked with actually leading this program. So that it will be interesting to hear Dr. Srivastav. Dr. Srivastav, it's your floor is yours.
Thank you, sir, and thank you to the organizers for providing me this opportunity. I will be presenting on the health mission of climate change and also about the national program on climate change and human health. I would like to share the forefront. It has been the effective leadership of C.K. Mishra ji and R.T. Ahuja ji and other senior officers of the ministries which have helped to shape this program. And so I'll try to take you through what this mission has been about and what this program is about. So under the Prime Minister's Council, the one of the mission that came at a later stage, as was shared by C.K. Mishraji, was the health mission. It was proposed in the year 2015, and while health ministry is the nodal ministry to implement on it, we at NCDC have been providing the support to the ministry in implementation of the program. In the initial stages, when the mission was announced, we worked through a technical expert committee on development of a national action plan on climate change and human health, and its documents have always been evolving since then. We have also very recently updated it as per the requirement of the Executive Committee on Climate Change. The health mission document was reviewed by the council in the year 2019 and very recently again in the February 2021 with an updated version of the national action plan. To run this mission for supporting the states, it was decided in the ministry that that it should be included under the National Health Mission of the ministry, and the NHM Mission Steering Group approved it as a program in the February 2019. Since this approval, we have worked with all the states across the countries to establish the program in all the states. The country is a diverse country with various climatic zones, and it is important that each state is represented through a state officer and each district is represented through a district officer to independently take into the challenges that the concerned state or the district may have. We have been able to uh, request the states to appoint a state nodal officer in almost all states. We have also been able to, in almost more than two-thirds of the states, establish the state-level environmental health team. This is a team that supports the state nodal officer in working for the purposes of the climate change program. There is also an establishment under the Secretary of Health of the concerned state, a multi-sectoral task force, which is a body that provides inputs from all the sectors that have concerns in climate change and advises the Secretary of the Health of how their concerned departments can be of help in this concerned undertaking. Its governing bodies have been constituted in much lesser number of states, but these are much higher number of much higher organizing structures that give policy inputs to the states on their climate change program. Almost 28 states have submitted their first draft of the state action plan, which are almost quite in ready shape, except for a few little bits that needs to be done with them. And we are working with the other states for the submission of their state action plan. We've also been able to make 26 states appoint their district level officers under the program. So as Madam Atia Ahuja has said, we have 5 key objectives in the development of the program, which come from the World Health Organization guiding document of what health adaptation plan should be about. The first objective is about generating awareness. We undertake various activities, including IEC campaigns, sensitization workshop, and Institute of Advisory for effective information dissemination. The second is capacity building. We work towards building up the capacity of the health professionals and providing them guidelines. We organize workshops for the training as well as for dissemination of guidelines. The third is steering the research on climate sensitive diseases. For the Ministry of Health, ICMR is the main research body, so it steers the research agenda for the climate change. We from the ministry support them in questions that might be relevant. The next objective is to strengthen the health sector preparedness that largely comes from preparations of health adaptation plans. Just as we have a national action plan, each state is supposed to be working on a state action plan. And each action plan has got many chapters. Each chapter relates to some or the other climate sensitive condition. And we have the centers of excellence who provide support in developing the subject specific action plans, and altogether it is consolidated as one state level or a national level action plan. We also work with the centers of excellence on the vulnerability needs assessment and also on issues of enhanced surveillance of climate sensitive diseases. As of now, we work on only two, that is air pollution and heat related surveillance, but we would in times to come spread out to other climate sensitive issues. And of course, the last is collaborating partnership. We work on interministerial and also working with other program divisions in strengthening climate change objectives. So now I will go by one of the initiatives in the key objective. For example, in the advisories, I'll give an example of some of the health advisories on air pollution that we have been sharing with the states. In a similar level, we have heat waves related advisories, which are also issued every month from February, as the seasonal outlook by IMD mostly suggests that heat waves hit the country from the month of March. We also have IEC campaigns on climate sensitive illnesses. I'll share, for example, some IECs that we have worked on air pollution and also on heat. We also have audio video content. I think I will not be able to right now we show them, but they are available on the NCDC website. Most of the state governments have the opportunity to download these IEC content that we develop, and then they translate it into their local languages, and then we also try to use those IEC documents for disseminating to other states which have similar languages. We've been holding the sensitization workshop wherein policymakers, senior officers, as well as health department officers are invited to understand the program and its components. We celebrate almost every year the World Environment Day. The last year we did it an online event, whereas the years before we have been celebrating it as a physical event to work together with various colleges, medical colleges, and also with the state government celebrating it in their own states. Last year, we also had a campaign run on a clean air for Blue Skies campaign, which was a campaign that ran for almost 1 week in September, and almost a large number of villages across the country participated in this campaign. The next is capacity building. We've been working on training of the state and district level officers on the program because of the COVID restrictions. We have been largely been doing that online last year, and around 9 states have already been able to undertake the TOT trainings. For officers who work in the hospitals and participate in the surveillance, we have been conducting trainings for them as well. So in the year October, November, we conducted for air pollution surveillance training. We've been developing training modules in partnership with the COEs and use these training modules for community level training. So this is the one that we developed with the COEs for air pollution in both English and Hindi language. And also PGI helped us in developing certain handbooks which have a lot of pictures and makes it easy for the people to understand their role in air pollution activities. We've been working with the councils to ensure inclusion of climate change and related subjects in the teaching curricula, and we have been provided a promise. Much of the work is going on in the working boards of these councils where they develop the curricula. We undertake review workshops with the state program officers on what achievements they have made and how we can support them in various aspects of the program. In context of research, as I said earlier, ICMR is one of the is the leading body that holds the research committee to look into issues of climate change and related environmental topics. We also work with the Ministry of Environment for their environmental health profile study, which is going on in 20 cities and would be one of the important information that can be give a baseline understanding of environmental health issues in the country. And we've been conducting workshops along with World Health Organizations and other, wherein we have invited all India-based research organizations which have worked, or even uh, international organizations which have worked on uh, evidence on air pollution impact in India. And we assimilate all these, and we have developed a compendium which is also available on the NCDC website. The next area is strengthening of the health sector. We have, as Madam Atia Hauja said, we have a large number of centers of excellence, and it sometimes becomes too difficult because it's so many diseases, almost so many consequences of climate change. But we are very hopeful for a support from all these organizations in providing us support to develop the specific health adaptation plans and also developing training modules and conducting TOTs for these program officers in the states and districts so that they understand how these subjects are affected by the impact of climate change. We've been working on two surveillance as of now. One, we initially started with the city of Delhi, but now of the 49 cities from the 122 cities which are listed under the national program as the cities which are on priority, we have around 60 hospitals which have started providing us data. And for example, if you look at this graph, you can see that from summers to winters, as the AQI levels would worsen, so would the number of footfall of emergency of acute respiratory illnesses would increase in the city of Delhi. I'm sure similarly we'll be working with other cities. And also similarly, we collect data on heat-related illnesses throughout the season of March to July. And if you can see, we notice with the data analysis from 2019 that as soon as the temperature rises to 41 and above, the number of deaths proportionally increase. There are heat alerts that are issued by the IMD, and we, with their support, try to send these heat alerts, which are for 5 days in advance to all the states. To experiment on vulnerability need assessment, we have worked in Puducherry with TERI supporting us in this. We look forward to doing it in other states. Climate resilience and green, the previous presentation was all about how the health sector needs to, health facilities need to be climate resilience and green. So we, with the Indian Public Health Standard, developed the principles and have submitted them. They have been accepted in the ministry and will be used for secondary and tertiary care health facilities. And we will continue to work on developing further guidelines with support of WHO and other organizations. In context of collaborative partnership, I would like to specifically mention the commitment that has been made by the ministries. We have now an interministerial level committee, which is co-chaired by the Secretary of Health and the Secretary of Environment. And the first meeting of the same was held on 4th December 2020, wherein representatives of Joint Secretary and above level from almost all relevant ministries had participated. And we are going to develop a joint working group which will look into the working agendas. We also work with different programs like NVDCP, NCD, EMR, disaster, because they all of them look into climatic sensitive issues, and we collaborate with organizations that work on related topics like NDMA, IMD, CPCB, WHO, UNEP, World Bank, and others. So this is the list of the COEs that I've been talking about. The health subject specific adaptation plan. So I'm just giving an example about the air pollution. So last year, we finalized an health adaptation plan on air pollution, wherein three centers of excellence contributed: UCHAI Chandigarh, Vallabh Patel Chest Institute from Delhi, and AIMS Delhi, because they look into different areas, including allergic and cardiopulmonary consequences of air pollution. And these chapters have understanding of what will be the structural functional flow of activities, what will be the roles and responsibilities, and the graded health response plans. And in similar manner, we are now working with all the other COEs for development of similar health adaptation plans. Thank you.
Thank you, Dr. Srivastav. Thank you for that comprehensive layout of what is happening. As is always with such webinars, we really behind time. And so the next is, of course, the question and answer. But I would like to just hand over to the organizations to take this forward from this stage as far as the question answer session is concerned.
Thanks, Dr. Mishra, and thanks, Dr. Akash, and thank you to Dr. Rashid. I think we'll take the question and answers at the end. If any of the panelists right now have comments to make, we are happy to include those last remarks from you. Otherwise, we'll move to the second session on tools and adaptation planning and assessing health benefits. So, sir, would you like to add any comment?
No, not much except to say that the two panelists who spoke really gave us a perspective of the national as well as the regional scenario as it emerges today. We appear to have plans in place. We appear to have structures built up in place. Now, as I said initially, a program design must be formed for actual implementation. If we are able to do that, we'll be moving ahead in the right direction. And I would leave it at that for the moment. Thank you.
Thank you, sir. Vidhu, would you take us to the next session? And thanks,
Sure.
Dr. Akash. Thank you.
So the next session is on the tools for adaptation planning and assessing health benefits. I would request Dr. Anand Krishnan, Professor, Center for Community Medicine, AIMS, and Dr. Kirtiman Avasthi, Senior Policy Advisor, Climate Change GIZ India, to kindly chair the session.
Thank you. This is Dr. Anand here. I welcome all the participants. I think we had a wonderful first half of this webinar. I thank TERI for inviting me to chair this session, and also as a chair of UCHAI, a loose network of institutions which has already been introduced by John earlier. I welcome all of you for this excellent webinar that is being organized. I'm glad that we have now started moving from science or evidence to action. I think we have been talking on science part of the climate change and health for a long period of time, not really moved towards action. And I'm glad to see that now we are moving more towards action and plans, etc. And actions are required at multiple levels: global, national, state, even at individual levels. We have seen today that globally there is an environment which is pushing for acting on environment, climate change and health. There are lots of tools and collaborations which are occurring at global level as well as at national levels. And we also saw excellently in the previous presentation that there is a high political commitment, and that commitment is getting translated into program in the Indian context. And also many states are moving in this direction. So I think it is very appropriate though I did not hear anything about budgets and money being sanctioned as a part of for implementing these action plans. That is something that maybe we'll hear later in this half of this webinar. So we have wonderful group of experts and administrators, national and international, going to speak to us shortly. I now request my co-chair to please take over and introduce the next speaker. Thank you.
Thank you, sir. I would like to thank organizers for having me here for this session. Just briefly, because we are also running late. So GIZ India has been working on behalf of German Ministry of Economic Cooperation, both at the national level and at the state level with its partner ministries and partner departments and partner organizations on various aspects of climate change apart from other priority areas topic. And on climate change, GIZ has been working, and I was also involved earlier with the Ministry of Environment, Forest and Climate Change, and now with GIZ, in this adaptation planning process at the state level primarily. When the whole process of the state action plan on climate change started. And now the revision exercise has started as per the guideline of the Ministry of Environment, Forest and Climate Change. We were working with the 8 state governments in the revision of the state action plan on climate change. The change that what we see in terms of the priority areas, of course, a lot of things are going into the revision process as the science of climate change has evolved, the vulnerability assessment have evolved, and also other priorities have emerged, both because of the national commitment and also international deliberation that are having on climate change. A clear shift in terms of priority we can see in terms of health sector. When we look at the SAP-CC, the first version, not much is talked about the health sector and impact of climate change and looking at priorities for that from that perspective. But in the revision exercise, this is actually coming from the very localized experiences at the state level, at even within the state, also from the district level. When we get into the consultation, a lot of impact because of climate change in the health sector. And this, so what I can safely say, the context and the case for having a comprehensive action plan or program on climate change and health is there, and this has been deliberated quite extensively in the previous session by the experts. I think and there is also a clear institutional mechanism which is set at the national level and also sub-national level. We have heard the additional secretary, we have heard Dr. Akash Srivastav also, whom we have been cooperating very closely. What I think is important is to translate that planning process, that policy support or that program support that we have at the national state level into actual planning and also implementation. And when we talk about that 3 main categories of adaptation action actually emerges when it comes to addressing climate vulnerabilities. First is the population, the community health and well-being. So looking at how to prevent avoidable diseases and also paying particular attention to vulnerable regions and vulnerable groups. I think this was also emphasized by Mr. C.K. Mishra earlier as well. The second aspect, second category is the health service delivery. And the third is the infrastructure resilience, looking at green infrastructure, the resilience to severe extreme weathers, extreme climate change event or disaster events. And within that context, I think it's important to look at what are the key enablers that will drive this planning process and then operationalization of the national program and also its key deliverables. And for me, I think when we hear our other panelists in the session, will be important is that the aspects of vulnerability assessment, because this was already emphasized that we need a clear indication of and clear evidence of the kind of climate risk that that the communities and the we are facing in the health sector, because that will help us in the prioritization of different climate adaptation strategies and planning process in general. This has been very well emphasized and clearly articulated in the action plan. I think we need to work clearly on the capacity development across the different level of governance, and also the organizations beyond the government setup, and also engaging the non-governmental organizations and promote collaboration and partnership. The aspect of like integration of the climate change into ongoing schemes of the health sector, so that this phenomena is integrated there. And then finally, because this session talks about adoption planning and assessment, so having a sound impact assessment or monitoring and evaluation strategy in place with the right kind of indicators to inform assessment, but to inform the impact of this kind of adaptation planning, and how communities are benefited from this integration of climate change into health sector planning process. And I think with this, I would like to welcome all the panelists in the session. Mr. Manjeet Singh Saluja from WHO, Ms. Meena Sehgal from TERI. We have been working very closely with both of them, Dr. Chris Smalley and Dr. Dhruva Ghosh. So welcome everyone to this session, and over to you, Dr. Anand Krishnan.
Yeah, thank you. I think I now invite Mr. Manjeet Saluja, National Professional Officer, Environment and Public Health, WHO India Office, to present on adaptation plans. Manjeet.
Thank you so much, Dr. Krishnan. And let me immediately share my screen. I hope it's visible.
Yeah, it is visible.
Great. So I think thank you so much for these words. And I think taking a cue from Mr. Mishra, kind of know where he said that I think there's already enough evidence. We kind of know what the problems are. And I think what we need to really move is to the implementation mode. And the focus of my presentation is kind of today, when we talk about climate change, climate resilience, health infrastructure, what kind of so the whole issue of adaptation planning, how the health facilities, this kind of the unit where we have to focus, which is the kind of the backbone of the health infrastructure, how they can be kind of made climate resilient. So I'll be focusing on those for the next 10 minutes. Just kind of taking you through a very brief in terms of is the slide moving? It seems
not yet. We're just seeing the first slide.
Yep. Right. So just to kind of take you very briefly through the impact of climate change and human health, although we all kind of experts who are present here do not need this background, but since there are kind of quite a few participants, we kind of are aware that climate change to kind of health systems are certainly disruptive for the individuals as well as for the communities when they kind of affect the healthcare facilities. Climate change can certainly impact the delivery of the healthcare services, and especially the large hospitals or even the small facilities. So it's irrespective of the size of the facility. Every facility gets affected, whether it's in a large metropolitan or even in a kind of a small village. And the increased frequency and the intensity of many of these natural hazards, challenges, the infrastructure and the support mechanisms and the supply chains that the healthcare facilities and their communities kind of depend on. And for example, kind of if we have been talking about sea level rises, and now the rains and the winds which kind of accompany many of the cyclones and the tropical storms, which are with increased intensity, they kind of cause an increasingly widespread and prolonged flooding, which kind of disrupts the vulnerable infrastructure and the supply systems and the transportation transportation systems associated with it. And the healthcare facilities, when we see it, they have not been built to physically and operationally cope up with these and other climatic risks, such as these kind of droughts or temperatures or fires and these changed patterns of these climate sensitive diseases. And in some parts of the country also, where kind of water scarcity and unpredictability in supply is increasing, kind of affecting the healthcare facilities. So preventing them from now, even the essential hand washing, hygiene, and kind of infection prevention and control services, this becomes very important when we kind of are in a COVID environment. So I think that's the overall effect. And if we really have to talk about climate resilience and what we have been kind of talking about, uh, uh, it's a kind of complex picture of of the concept of climate resilience. But in maybe in next 20 seconds, let me unpack this concept a little. And what I've talked about as kind of the shocks and the stresses which we kind of see out here, in terms of we already see that risk as a function of the vulnerability, and as what Kirtiman talked about, the exposure and the hazards. And we kind of see this the shocks, where kind of it brings to a stop to all the kind of to the health facility. And we also see some kind of stresses which are certainly, when we're kind of talked about the slow onset events, for example the droughts and the sea level rise, or maybe high volume of cases of the climate sensitive diseases, they certainly reduce the healthcare facilities kind of level of performance and the capacity, which is kind of on the left axis, through certainly a combination of impacts on the key facility elements. For example, maybe the increased vulnerability of the workforce, or maybe the increased exposures from wash and other healthcare waste, maybe the energy infrastructure, or maybe the infrastructure of the hospital, and then in turn kind of increase the risks. And the level of resilience, the right axis, will kind of define whether the facility will be able to recover to its pre-event state, or to a kind of a state worse than before, or maybe recover and attain a level of resilience which is greater than before the event. So what example kind of I think initially John spoke about the green recovery. So what we are talking about is maybe the health facilities after this pandemic are able to kind of attain a level of resilience which are greater than before the event, because there would be more pandemics kind of coming in. So certainly it also, the figure also tries to highlight the risk management, therefore steps of prevention, preparedness, response, and kind of recovery. And especially when I kind of talked about the key elements, so zooming into these kind of what are those key elements which the presentation would focus on. And we all know that as kind of responders to the acute climate events, we all want the healthcare facilities to be the kind of the last standing building, whether it's a disaster or any kind of pandemic. We because so that it delivers uninterrupted care. And the healthcare facilities certainly kind of provide health services to patients that may kind of vary in size, from small healthcare clinics to very large hospitals. And also in terms of I'll not go into the environmental stresses, but the main components of health workforce, wash, energy, and kind of the infrastructure, which I would be focusing on when we kind of really look at some of the health facilities which we kind of worked upon. Again, the framework which I think Rashid has already covered, so I'll not kind of go into it. Coming on to the project of kind of the climate resilient healthcare, which we a pilot study which we did in the state of Madhya Pradesh, to and this was to kind of certainly provide guidance for development of climate smart and resilient healthcare facilities at the hospital level. And what we wanted to do was to do an assessment from the climate lens, as to what are the vulnerabilities, what are the drivers of those vulnerabilities, and to develop an action plan. And for that, we kind of looked at two districts, Bhopal and kind of being the state capital, and one other district as Devas, and kind of looked at different levels of facilities, which is one as a PHC, a CHC, and then also a couple of district hospitals in kind of both Bhopal and kind of on and Devas. And the approach and methodology which we looked, which we kind of went for this, was to kind of certainly deepen the understanding, since there is is some guidance at the global level, but then what we had to translate was this global guidance to the field level and to kind of really at the PHC and the CHC level. So we wanted to deepen that understanding, and kind of in order to deepen the understanding, we wanted to have an assessment checklist on all these parameters, and those 4 indicators which we kind of talked about, we kind of focused on each of them. A vulnerability and risk mapping based on the existing information and information about the kind of infrastructure. Then we applied this checklist, spoke to a lot of stakeholders kind of in the state of Madhya Pradesh, not only from the health sector but also the allied sectors. And I think some of the Madhya Pradesh department was really very cooperative. So we identified the adaptation and the mitigation actions, and also what you said in terms of financing, the assessment of the financial resources for required for implementation of adaptation action, because otherwise it becomes a laundry list, and if you are not really able to implement those actions, so the actions have to be really seen from that perspective. And talking about, I think, the capacity building, and where awareness and capacity building, where we develop some kind of guidance documents and awareness materials, and and for creation of awareness among the hospital staff. So that was in brief the methodology and the assessment parameters, again in terms of the health workforce, where we kind of spoke about the human resources, the capacity development. So in next 2 to 3 slides, let me kind of very briefly, although this was a detailed study, I'll not be able to kind of do justice by sharing all the findings with the kind of paucity of time, but let me kind of very quickly go through some of the major points. In terms of the health workforce, certainly the awareness, and there was kind of a clear among the low-hanging fruits, that there was a kind of on the there was a staff shortage, which was kind of found to be somewhere kind of high or somewhere kind of low, but especially like for example in Devas, but in Bhopal being in the state capital, there was kind of less on those issues. In terms of awareness generation, at the hospital level, the staff members were certainly kind of aware about the climate change and its impact on health and other sectors. But when we really kind of drill down deeper, they were kind of not really able to understand the vulnerabilities and risks which are kind of in the context of the hospitals. And they had a general understanding, okay, the temperatures are increasing, there's an irregular rain, extreme events happening, but then how does it really kind of affect? And that detailed level of kind of awareness needs to be kind of created. There were greater efforts for certainly the building awareness and improving capacities. We also looked at some of the kind of in terms of it was noted that the hospitals were having the basic emergency preparedness measures, such as for emergency storage of foods and drugs, power backup facilities, ambulances. As per the NDMA guideline for the hospitals, they also need to have an hospital disaster management plan depending upon their bed strength and other resources. In terms of the environmental clearance and management plans, many of these hospitals were quite old. Some were 50 years old, some were 60, and some were kind of even the new ones which were kind of only constructed in 2004. Certainly the facilities in the new ones were much better and kind of than the old ones. Facilities also kind of did not some of them did not have a hospital disaster management committee, so that there is a business continuity plan which had been activated in emergencies to facilitate a continuing essential and kind of critical services to the hospital. And each facility also kind of was required to develop a incident response system kind of so that was also at many places missing, or kind of that really need to be strengthened. And on some of the other aspects, what we saw in terms of the human resource was, I think what was really which needs to be strengthened is on the search capacity and the kind of the space management plan, especially when during these kind of disaster issues, how when kind of there's how they can engage volunteers and other facilities in the pre-disaster phase, so that when the surge happens, they're able to cater to such requirements. In terms of the wash and the waste management aspects, certainly the healthcare facilities, we kind of see that we consume vast amounts of water for various drinking, cleaning, washing facilities. Facilities have reported that they have been receiving adequate supplies from the Nagar Nigams and the panchayats, but they also reported that they have around 2 to 3 day water storage as a backup facilities. But in terms of the biomedical waste management, yes, there was awareness, there was kind of no segregation happening, and we can kind of know. But again, when you kind of know in terms of the awareness, and especially during the pandemic, I think there's more space on this which we could had kind of know worked on. In terms of energy, yes, there is an each of the PHCs, even at the CHC level, there was a provision, I think, in terms of the solar power, which was kind of no very heartening to see. In many of the states have taken a lot of steps, especially Madhya Pradesh, Chhattisgarh. They have kind of no taken steps to really minimize their greenhouse gases emissions, and kind of have installed solars. But then facilities have also reported that they also need to kind of now move into the heating, ventilation, and air conditioning systems, which would certainly mean more power. So therefore, a detailed energy audit was kind of certainly required to compute the actual energy consumption by kind of different equipments. And but then there were kind of a lot of energy conservation and efficiency measures which were in place in terms of the procurement of 5-star rated equipments, kind of replacement of the LEDs, CFLs, such kind of measures which we could kind of see out here. I think a lot in terms of the infrastructure and kind of technologies and products. In terms of the infrastructure, first and foremost is the structural modification and upgradation. As I said, that many of these facilities were even 60 years back. They were kind of modified based on the availability of funds, but again, I think there a lot kind of needs to be done considering the kind of the current vulnerability to the climate change and associated risk. These kind of facilities need to be retrofitted to withstand the pressure of the patients which are suffering from kind of climate sensitive diseases, increased temperatures, and heat waves. The building design, I think these facilities, since they were established, many of them were kind of old, so there was no evidence was available in regard to compliance of any of the guidelines in early of the constructed buildings. So I think there a lot of work can be kind of undertaken to make these kind of but again, what we also saw is in some of the old construction buildings, there was a kind of a better cooling, and I think there they need to kind of take these forward and kind of in terms of the future action plans, they need to kind of really look from the green building design point of view as well. And I think some of the pointers which we have mentioned also. So the action plan kind of really focused on the 4 measures, and kind of in terms of these 4 measures, and addressing the drivers of vulnerability, and assessing and managing risks, and building response capacity within the states and the districts, and also addressing preparedness and mitigation. And within these 4 kind of what we did was to kind of really classify them, and each of them where we kind of did an action plan for each of the health facility in terms of the land use, the siting and the landscape, the climate vulnerability and risk, the infrastructure, the human resource and the climate preparedness, the implementation modalities, and last but not the least, in terms of the financial resources available with each of the health facility and at this district and the kind of the state level. So there, this action plan was shared with the state health department, as well as with kind of the environmental planning and coordination organization that state of Madhya Pradesh has to kind of for the climate change issues. And I think which was kind of shared, and in future many of this action plan, the elements of the action plan could be integrated into the respective district plans of each of the districts when they are kind of taking up, and could be submitted for funding actions. So that was kind of in a nutshell on the whole process of it. But what we really learned from this whole issue, I think what and that's where I need to focus on the last slide in terms of summarizing the learnings. I think what we really need to talk about is a decentralized action is certainly kind of very important as at the state and at the regional and the state level is the way forward. And each region and state can be, and even the district can be unique, and therefore we need to kind of really drill down to the health facility level and kind of do these kind of analysis at a decentralized level. and the one size fits all kind of does not work. There are requirements again at a different levels at a PHC, CHC, and a district hospital, and we kind of I didn't go into the details of what were the differences, but then there were issues kind of and that's why in terms of the action plan it needs to be kind of really different, and it will not work for kind of and then the planning, finances, and implementation is certainly kind of using an incremental approach. We cannot kind of think about doing all at one go. This has to be kind of incremental efforts where in each of the district plans or kind of when they are doing it, they can take up these small increments and kind of start doing. But there needs to be a kind of clear plan so that each of the year they need to be kind of doing certain small improvements and kind of with this incremental approach so that they're able to kind of achieve these targets. And I think an integrated, what we kind of really talked about is an integrated vulnerability risk mapping for climate and health is the kind of the key first step for these processes. We really need to kind of really look from the vulnerability risk mapping point of view and then kind of move ahead in terms of developing these action plans. So that was in a nutshell the experience what we kind of had from the state of Madhya Pradesh for a few facilities, and from especially the health facility point of view in terms of the planning. I think that's it from my side. Thank you so much for this opportunity. Back to you, Dr. Krishnan.
Thank you, Manjeet, for that ground level feedback on how health facilities what they need to do and where we are in terms of at least one example from Madhya Pradesh. We can go to the next presentation, which will be by Meena Sehgal, Senior Fellow, Environmental Health, the Energy and Resources Institute. And after her presentation, I request my co-chair, Mr. Kirtiman Awasthi, to take over for the next two presenters. Thank you. Meena.
Thanks, Dr. Anand. I'll straight away go to my screen and share my presentation. Let me know if you can see view.
We can.
Yes. Okay. Thanks
yes,
a lot,
it is visible.
sir. So at TERI, we are working on several issues of. Okay. Thank you. So at TERI, we are working on several issues of environment and health. Supporting building of health sector resilience is key of key importance to us. So public health in India is getting impacted by climate-linked factors through many different pathways. Thus, there is a need for measuring the health impacts, need for adaptation and mitigation to reduce harm to health. I won't go into too many details, but warming increases the number of hot days and nights, exposes more population to extremely high temperatures and heat stress. We've already witnessed deaths from heat waves. One concern is that the Himalayan region is prone to abnormal floods, droughts, and landslides. And another is that Hindu Kush region is the only other place where there's permanent ice cover outside of the North and South poles. What it results in is that India has become one of the global hotspots for floods. With rising temperatures of sea surface, we expect more cyclones and height of the storm surges are likely to increase also. The climate-associated disasters are widespread. According to the National Disaster Management Authority, 68% is drought-prone, and 12% of India's total area is prone to floods. So how does this get accounted for? Typically, the way these are measured on health is how many people die from a particular extreme event. So quarter of cyclone deaths are from northeastern India, quarter are from for extreme rainfall are also from northeast India. Quarter of the heat wave related deaths are from northern India, and half of the cold wave deaths are from northern India. But disasters affect health beyond just in terms of death. They affect extreme events affect lives and livelihoods. And year 2020 alone, we witnessed floods in Bihar, cyclones in Kolkata, and forest fires in Uttarakhand. So, yeah. So is counting deaths, number of people death, is that the best indicator, or can we have better indicators which would cover mental stress of the people, delays in treatment, disrupted nutrition supplementation, medical supply disruptions, or increase in certain diseases like fecal oral disease pattern? So some such information we think would help build better shelters during emergencies, have better action plans, and better trained medical forces to support. And then there's an issue about disparity of where the climate hazards are and which parts are more. There are certain parts which are more at risk. For example, floods affect the eastern coast much more than the western coast. So Puri, Chennai, Nellore, Cuttack are the areas which get more affected by floods. Similarly, heat waves are not uniformly affecting the entire population. States of Andhra Pradesh, Telangana, Odisha, Gujarat, Rajasthan are more affected by heat waves. And building resilience, as prior speakers have also said, that some of the cities have created action plans. They give health advisories. They have created cooling plazas, and there are some zoning laws also in place. So people have improved their health infrastructure. They've improved their city plans to make them more greener and increase water retention through the landscape. However, warming is more worrisome because it impacts agriculture also. There are direct impacts, but besides that, heat waves and droughts impact agricultural production. Climate change is anticipated to adversely affect both quantity and quality of food grains. And nutrition security is important for India, as 4 out of 10 children are undernourished and 6 out of 10 are anemic. TERI is promoting development of green technology hubs in rural areas, strengthening food supply chains to increase access to affordable micronutrients throughout the year. This would be possible as India is one of the top producers of legumes, milk, fruits, and vegetables. But despite all this, India ranks 94th in the Global Health Index. Another stressor is increase because of warming is increase in vector-borne diseases. And this is particularly seen in eastern and northeastern states. There is a high prevalence of vector-borne diseases, particularly malaria. The spread of vectors is likely to increase as more areas become warmer. For this, TERI has been promoting integrated digital platform with information on meteorology and disease prevalence. So a better forecast of disease can be made, an early warning system and a response mechanisms can be put in place. Air pollution, particularly black carbon and particulate matter, contribute to warming of ice and altering of precipitation and cloud patterns. Besides, particulate matters impact health in many different ways. So over the past few years under different projects, we've created tools and methodologies to build decision support systems for health sector resilience. One of these tools is predicting hotspots for vector-borne diseases such as malaria. This tool uses meteorology variables, uses satellite-based data on vegetation index, elevation, and water. And we've noted good correlation between our predicted prevalence and the observed data. So the use of this tool could be in better preparedness of primary health centers, community health centers, and timely actions for malaria control measures. We are developing a platform which would help predict air pollution linked diseases in cities such as Delhi. For this, we are using meteorology parameters and air pollution concentrations to predict their influence on hospital admissions and clinic visits. Another tool that we've been using for Ministry of Health also is predicting vulnerability to climate-associated diseases. It uses an array of 20 indicators ranging from meteorology parameters, literacy rates, socioeconomic status, health infrastructure, and disease prevalence. Using complex statistical methodology, it computes an index and ranks districts, thus supporting identification of targeted interventions. We are supporting, as you've heard before, UCHAI platform. Here, lots of information on linkages of climate change and health is provided. Opportunities for networking within the health community is provided. And this is an initiative which has been taken up by through partnership with several institutes, government and non-government organizations. So undertaking actions on building health sector resilience will require convergence, like the previous speakers have also said. Mr. C.K. Mishra also emphasized that we need convergence of various departments: meteorology, urban development, transport, energy, water and sanitation. And this convergence would not only help build health system resilience to climate change, but also achieve several SDGs. And with this, I'll end my presentation, and thank you.
Mr. Kirtivan, can you introduce the next two speakers, please? Thank you, Meena. I think in the interest of time, I'm going to introduce the next speaker. Dr. Chris Malley, Senior Research Fellow, Stockholm Environmental Institute, UK, on practical tools for the assessment of health benefits from climate change mitigation, focusing on air pollution, diet, and agriculture. So, Dr. Malley, the floor is yours.
Thank you very much. Thank you to both of the two chairs for this session, and thank you for the invitation. It's really nice to be here. My presentation is slightly different to the other presentations in that I will be focusing on the human health benefits that can be achieved from climate change mitigation, and how we can move, as one of the previous speakers put it, from talking about the science to talking about the practical actions that can be taken to achieve these benefits. I'm sure most people are aware, and we've had a lot of presentations talking about air pollution, but the key thing that I would like to highlight is not just the ability of climate change actions to improve human health. I'd like to talk about the opportunity for how health benefits can help to increase our climate change mitigation ambition. And air pollution and the health impacts of air pollution are a good example of this. The graph on the screen here is a study from the European Commission Joint Research Centre, published in 2018, which evaluated the reductions in air pollution that could be achieved from countries' existing climate change commitments, shown in the yellow line here, and what could happen if we increased our climate change mitigation ambition to be consistent with the goals of the Paris Agreement in limiting climate change to well below 2 degrees. What they found was that the reduction in air pollution could avoid 300,000 premature deaths if we stuck to the commitments that were made in 2015. But if we increase our climate change mitigation ambition, we could avoid over 1 million premature deaths per year by 2050 from the improvements in outdoor air quality. So not only can our climate change actions help to improve health, if we put a focus on trying to emphasize these health benefits, we can also increase our climate change mitigation ambition. I maybe don't need to emphasize this, but just to highlight the links between air pollution and climate change, we have two. Between the air pollutants that are causing health impacts and between the greenhouse gases causing climate change, we have overlapping sources that are producing, that are emitting air pollutants and emitting greenhouse gases. But then we also have this group of pollutants in the middle, the short-lived climate pollutants that both impact human health by acting as air pollutants and warming the climate. So we have these two intersections between air pollution and health impacts and greenhouse gases. So that's the science, that's the opportunity globally that we can achieve by taking climate change mitigation and human health as an integrated package. But the specific actions that can be taken to maximize these benefits for health and climate change are different in different countries, depending on the different emission sources that we have, the different economic sectors that are producing the largest source of emissions. So it's our goal in the Stockholm Environment Institute, working with organizations like the Climate and Clean Air Coalition, to build the capacity of national planners to identify these sources of emissions of air pollutants and of greenhouse gases, and then to understand how those emissions affect exposure to air pollutants, impacts on health, and impacts on climate change. And SEI develops a tool called LEAP, the Low Emissions Analysis Platform, that is a scenario-based tool that is designed to be used by national planners to understand their emissions, how they are likely to change into the future, and how the implementation of different policies and measures can reduce those emissions. We've added a module to the LEAP platform that called the Integrated Benefits Calculator that takes those emissions and models their transport and chemical reaction in the atmosphere to assess how they affect people's exposure to air pollution and the impacts that that then has on human health. I want to provide a concrete example of how the application of tools like LEAP IBC can lead to the development of plans and strategies that maximize benefits for human health whilst achieving climate change commitments. I want to highlight an example for Bangladesh that has been a member of the Climate and Clean Air Coalition, the only global organization that's made up of about 140 members, designed to achieve these climate change mitigation and air pollution benefits. It was a founding member of the CCAC, and since 2013 has been trying to identify and develop those strategies that can have the largest benefits for air pollution and climate change mitigation. And the Department of Environment, working with the Bangladesh University of Engineering and Technology and SEI and others, were interested to understand what the local air quality benefits would be from achieving their climate change commitment, achieving their nationally determined contribution. And the LEAP analysis that tried to quantify those local benefits was the basis for the development of Bangladesh's National Action Plan to reduce short-lived climate pollutants, which was endorsed by the Ministry of Environment, Forest and Climate Change in 2018. LEAP IBC was applied to first understand the contribution of different emission sources to the emissions of greenhouse gases. You can see on this graph, CO2 at the far right-hand side comes from industry, comes from power generation, from transport. And then you can see the range of other pollutants, of air pollutants like particulate matter, black carbon, nitrogen oxides that are emitted at the same time as carbon dioxide from many of the same sources, from residential combustion, transport, industry, power generation. So we understood where the pollutants impacting health and where the pollutants impacting climate were coming from and what overlap there were in those sources. I think the key thing to build on what one of the previous speakers said about moving from science to action is about identifying those concrete, discrete actions that can be taken to achieve the to achieve the reductions in these pollutants? What discrete actions can be taken? And that's why in the development of Bangladesh's National Action Plan to Reduce Short-Lived Climate Pollutants, we evaluated specific actions like banning the burning of crop residues, implementing vehicle emission standards, increasing the renewables used for electricity generation. So we're understanding exactly what benefits we can get from the implementation of discrete actions. And when we look at all of those together, we can then see what benefit they could have to health. The reduction in outdoor air pollution was estimated to avoid 12,000 premature deaths from ambient air pollution exposure per year. And the large conversion of household cooking from biomass to LPG and more efficient biomass stoves was estimated to reduce household air pollution substantially and avoid over 100,000 premature deaths per year, predominantly women and children. And the development of these plans that have discrete actions and that have quantified health benefits alongside the climate change reductions have led to a large number of plans and strategies being developed in a diverse range of countries. And I think one thing that's interesting that a previous speaker mentioned about human health not being emphasized enough in climate change discussions. I'm not an expert in adaptation, so I'm sure that's correct. But one of the encouraging things I think that we are seeing as countries submit their updated climate change commitments is a much greater focus on health compared to those commitments that were made in 2015. We see in countries like Bangladesh, but also in countries like Mexico and Chile and Colombia and Nigeria and others, much more of a consideration of health benefits from their climate change mitigation actions. So perhaps there's something there for the adaptation community to assess and to reflect on as well. I'd like to just finish by highlighting that and recognizing what another previous speaker said about there having been a lot of discussion about air pollution, but the health benefits from climate action being substantially broader than that. I completely agree. And as part of SEI's integrated climate and development planning initiative, it is our goal to extend the formula that we've developed with LEAP IBC and air pollution to be able to allow national planners to consider a much broader range of health outcomes and health risks within their climate change mitigation planning in 2021. So we're actively enhancing LEAP and other tools within SEI so that they can be applied by planners to understand the health benefits from switching to improve wastewater management systems, to understand the health dimensions of different transport strategies through road safety and through the health benefits of walking and cycling and non-motorized transport. And I think most importantly, and something that a few speakers have touched on relating to adaptation, is understanding the connection between the health impacts of diet and the climate change impacts of the food systems that the agricultural systems that produce that food. From a mitigation point of view, that consideration of the health impacts of food systems has not been widely used in the prioritization of actions in the agriculture sector for climate change mitigation in countries' climate change mitigation planning. I definitely do not have time to go into this diagram, but just wanted to highlight that we have developed a model that is being integrated into the LEAP platform that looks at food demand and then estimates the emissions associated with the production of that food through crop and livestock systems estimates the greenhouse gas emissions and therefore the climate change impacts of those agricultural systems. Again, it's a scenario-based modeling framework so that we can assess how switching to more efficient agricultural systems or different types of diets would affect emissions. But I'd like to draw attention to the module on the top right of the screen, which is the health impact assessment component of this modeling framework. Our modeling framework to assess the climate impacts of food consumption starts with the average calorie intake and how that is met from different types of food products, as well as driving the greenhouse gas emissions coming from the agricultural systems. It also is used to estimate the proportion of the population that are undernourished or overweight and obese, or exposed to particular dietary risks like diets high in red meat or low in fruit and vegetables and legumes, to then understand the number of premature deaths associated with the cardiovascular, the carcinogenic, and other risk factors associated with different dietary health risks. And this allows us to understand, for example, on the top left of the screen, the proportion of a population that are undernourished, the proportion of population overweight, and the health impacts associated with those dietary risks, alongside the emissions of methane and nitrous oxide and other air pollutants that are emitted from the agricultural systems that produce that food system, and to assess how changes in food systems can contribute not only to climate change mitigation, but also to achieving that climate change mitigation in a way that maximizes benefits to health through improved diets and reduction in poverty and malnutrition. I think I will stop there. Thank you very much for the opportunity to present at this webinar.
Thank you, Chris. Now we move to the next presenter, which is Dr. Dhruba Ghosh, Senior Advisor, Health Advisory, Think Through Consultancy, who are one of the part organizers of this webinar. Dr. Dhruba Ghosh, please.
Dr. Ghosh, you are not audible.
Your slides are also not yet visible. Dr. Dhruba Ghosh, can you
just it's not coming. Even the mute is not, it is not coming.
We can hear you now.
Can you hear me?
Yeah, we can hear you.
Yes, maybe you can start speaking, yes, Dr. Ghosh.
Just a second. This one, I'll just give it a try. Can you hear me?
Yeah, we can hear you quite clearly.
Okay.
We can't see your slides, but we can hear you. So you can go ahead and give a talk without the slides. Or you can send your slides to the organizers and maybe they can show.
Yeah, just a second. Yeah, we're still trying to.
We are able to see it.
Yeah.
We can see the slides.
Thank you, Chair, and thanks for the patience. It was great to learn about the various initiatives taken to address climate challenges and adaptation plans from various speakers. Now, before we talk about climate resilient, environmentally sustainable healthcare facilities, we are aware that the health sector's mandate is to cure diseases, but often inadvertently it contributes to the problem. Hospitals generate significant environmental health impacts, both upstream and downstream, from service delivery through the natural resources and products they consume, as well as through the waste they generate. When we talk about environmentally sustainable healthcare facilities, the climate component comes into play naturally, as climate and sustainability are linked in many ways. Sorry. So, when we talk about a green healthcare facility, what is a green healthcare facility? As the definition goes, it is one which enhances patient well-being and aids in curative process while utilizing natural resources in an efficient and environment-friendly manner. Now, what are the attributes of a green healthcare facility? First, it promotes public health by continuously reducing its environmental impact, eliminates its contribution to the burden of diseases. It recognizes the connection between human health and environment. Eco-friendliness is adopted at all levels in these healthcare facilities, including in governance, strategy, and operations. It also helps in connecting local needs with the environmental action and practices primary prevention by engaging in efforts to foster community environmental health, health equity, and green economy. We are talking about resilience. Now, what is a resilient health system? There are several definitions, theories, models as far as resilience is concerned. Now, when we talk about a resilient healthcare system, we mean that its ability to adjust its functioning prior to, during, or following changes and disturbances so that it can sustain required performance under both expected and unexpected conditions. Now, to do so, the capacity of the health actors is very important. We need very skilled health workforce and institutions and populations who are prepared for and effectively respond to the crisis, so as to maintain the core functions when a crisis hits and informed by lessons that we learned during the crisis. Reorganize it if conditions require it. Now, what are the 4 resilience potentials of a resilient healthcare system? First, anticipating, knowing what to expect and prepare for it, monitoring, knowing what to look for, responding, knowing what to do and adjust to disturbances and changes, and learning, of course, knowing what has happened and learn from experience. Well, as far as the environmentally sustainable healthcare facilities are concerned, there are 10 focus areas. But they have very strong connects. Some of them have very strong connects to the climate resilience. What are they? Which are the ones which have connects to the climate resilience? Energy, water, transport, and buildings. Now let us start with the first focus area for an environmentally sustainable healthcare facility. Leadership. It must prioritize both environment and health. Chemicals, which would involve substitution of harmful chemicals with safer alternatives. Like we know that there is a constant effort to eliminate mercury-containing devices with safer non-mercury alternatives, phasing out phthalates containing PVC medical devices and switching to safer plastics. The next is the waste, which is a very critical component of a healthcare facility. The idea is to reduce or minimize waste. Now, minimization of waste is through resource reduction, segregation, and resource recovery and recycling. We know that a lot of the anatomical waste which gets collected in plastic bags are incinerated, and this leads to the emissions of dioxins and furans, which are carcinogenic. Therefore, Therefore, there is a need to explore newer technologies to reduce incineration, and need be, they must be adopted. The next component or the next focus area is energy. Energy management first would focus on reducing the consumption of energy through use of energy efficient appliances, efficient air conditioning and refrigeration technologies, efficient lighting system, and last but not the least, sensitizing the hospital staff, inculcating energy saving behavior. Now, this can further be complemented through the use of renewable energy. In remote areas, decentralized renewable energy can be an efficient mechanism. And in India, indeed, Chhattisgarh and Maharashtra are the two states which have deployed it very efficiently across the healthcare facilities. The renewable energy sources in most of the cases involved include the rooftop solars, local wind turbines, local biomass-based power, and in hilly areas, small turbines for harnessing power from local streams. Now we move on to the next component, water. Eliminating water wastage within the facility is a priority. Harvesting rainwater and recharging in-house reservoirs to develop self-reliance for water sources, installation of RO for potable drinking water, installation of ETP and STPs at eligible healthcare facilities, use of the recycled water for housekeeping and other purposes. Next comes transportation. Now, the health sector has one of the highest number of transportation fleets, which encompasses the hospital ambulance fleets, healthcare facility vehicles, public health service vehicles, delivery vehicles, staff transportation, and patient travel. Adopting electric vehicles for transportation will reduce the environmental footprint definitely. Encouraging the staff and personnel to use public transport system could be another measure. The healthcare facilities should promote bicycles, especially within healthcare facilities with residential premises. Now, when it comes to food, purchase of sustainably grown organic food is what these healthcare facilities would go for, and drug-free local produce, or in fact have an on-site garden, organic garden, if the space permits. Pharmaceuticals need to be managed safely, and dispose of pharmaceuticals is very important as they have the ability to contaminate the soil and groundwater. And that holds true for chemicals as well. So safe disposal is very important. Landfills are not encouraged, and neither is it desirable to dump in the sewer. Next, the most important focus area is the building. Now, when we talk about buildings, there needs to be certain factors that need to be considered. Reduce the environmental impact from the location of a building on a site. Environmental impact assessment and environment health impact assessment of proposed sites should include climate vulnerability and carbon footprint as well. It's important to ensure that buildings on the site can withstand extreme weather events now and in the future as well, because we are talking about climate resilient healthcare facilities. Enhancing natural lighting and effectiveness of artificial lighting through building designs. Improving the air quality inside a building through entryway systems to capture dust particles, use of indoor plants, using zero volatile organic compounds, can be other measures, need to be kept in mind. Clean and green interior building materials need to be used, especially when we are considering paints that are used or the interior surfaces that need to be resistant to the growth of microorganisms. Use of copper-based materials are also encouraged. And last but not the least, landscape, and gardening are an important part of an environmentally sustainable healthcare facility. The last area of focus is purchasing. So when we are talking about an environmentally sustainable healthcare facility, it is obvious that one would go in for safer and more sustainable products and materials that are used in these healthcare facilities. Now we talked about all these how to have an environmentally sustainable healthcare facilities. In fact, in India, we do have a number of environmentally sustainable healthcare facilities in the urban areas. And even in states like Madhya Pradesh, Chhattisgarh, and Maharashtra, they have taken great initiatives towards moving into environmentally sustainable healthcare facilities. So the next question that arises is how to, have more and more of these environmentally sustainable healthcare facilities. One way out is to attract private sector investments. In India and in most of the developing countries, except for limited private initiatives in setting up healthcare facilities in urban areas, most of the rural or the remote areas, the healthcare facilities that we see are under the purview of the public or government initiatives. But the trend is changing now, as many private players are investing into setting up healthcare facilities in both rural and remote areas. We all know today that private funds consider climate risk very seriously in any investment decision. Therefore, it will be easier for healthcare facilities to attract private finance if these are based on climate resilient designs. It is therefore of utmost importance that climate resilience is seriously considered for not only setting up new healthcare facilities, but also for renovation of the older and existing healthcare facilities. With this, I end my presentation. Thank you for patiently listening.
Thank you, Dr. Durba Ghosh. Organizers, do we have time for question and answers? So I think we are already delayed.
Dr. Krishnan, over the part, I think we can have 5 minutes of question and answer and reduce the concluding remarks time. Thank you.
Yeah, so if there are any questions, the organizers may let us know how they are going to do this questioning. Is it through chat or?
Yeah, I don't see any questions in the chat box. And I'm trying to see if there are in the Q&A box or another place.
So, Dr. Kirtiman, if you have any concluding remarks, please go ahead.
For the choppy connection, it's like through mobile phone now, but I think we started with and our expert panel.
We can't, at least I can't hear you very well.
Same here.
Covered these points very clearly. Aspects of what we thought of community well-being and looking at the climate resilience from that perspective. Yeah, I think I'm looking for my comment because I really have bad connection. Thank you.
Thank you, Kirtiman. I think we had very clear message from our panelists that first is set your own house in order. In other words, for the health system to have a first move towards developing climate resilient health facilities. But overall, I think after today's, I'm more optimistic about the way we are going. Because I see that we have enough knowledge of what to do. The environmental, both global and national, is very conducive. We have the tools, and we even also have started having state governments preparing their machinery for implementing these tools. So overall, I think we are quite optimistic of moving forwards to implementing a lot of these things that was discussed today. And as a member of the Center for Excellence for Cardiopulmonary Disorders at AIIMS New Delhi, as well as a chair of UCHAI, I think I'm committed to working with the governments, both state and the national, and also communities for implementation of these adaptation plans, developmental and implementation of this. Along with my co-chair, Mr. Kirtiman Awasthi, I thank the organizers for this webinar and hand it over back to the organizers. Thank you.
Thank you, Dr. Anand and Dr. Kirtiman. I really appreciate your efforts and your time. We had very good thought-provoking ideas and concepts shared by different speakers, right from the ministry, the former secretary, WHO, NCDC, GIZ, SEI, and TTC. The presentations reflected their personal enthusiasm and the speakers' enthusiasm and the institution's vision. So we see a lot of enthusiasm, and I hope it translates into few well-designed, well-defined intervention projects, which can provide learnings and vision for scaling up. With this, I would like to end the webinar and also want to thank TERI organizers, the webinar organizing team, and the environment health team they've all worked very hard to make this webinar a success. Thanks a lot. And with this, I think we'll end the session and hope to meet again in person and over webinars. Thank you.
Thank you.